why you can have issues with your knees. So we are going to go through some of those things. Hold on a second. Hold on a second. Let me. This is not the one that I want. Because I put an intro in there for you guys.
We can all emphasize.
All right, so you know what? We're just going to go through this because the one that I am supposed to have on here that I spent all kinds of time last night kind of polishing up is not the one here. Okay, so knee pain solution. So basically, everybody knows where their knees are, okay? And if you're in here, you probably have some issues with your knees. I'm Sandy Kappas. I have Back in Action Physical Therapy. I have been practicing in Ocean Pines for the last 8 years. Opened our practice in 2012. We're right across the street from Southgate Grill. I try to do classes that I think that there's a lot of people that could benefit from the classes, understanding what's going on and things that we can do to help with that. Personally, I have knee issues. I was a softball player for many, many, many years. Loved steel bases. Always was sliding into the bases. I later was in a pretty severe car accident. Ended up with a surgery on my knee. And since that time, they've decided that that's not really a good surgery, so they don't do that surgery anymore. So now I'm kind of stuck with some problems with that knee. So I have to do things to be proactive to make sure that I don't have knee pain and that everything is nice and stable within my knee. So there's a lot of different bones and tissues that surround the knee. That's actually a picture of the hip. The hips are actually an important part of keeping those knees healthy. So if the hips aren't properly functioning, you're going to have issues with how that knee is functioning. So there's lots of different structures that help to make up and give stability to the knees. One of the things are your tendons, and a lot of times people are a little confused. What's the difference between a tendon? What's a ligament? So a tendon is actually the continuation of a muscle. Okay. So for instance, with the quadricep muscles, the big muscles on the front of the thigh, there is a tendon that comes down, okay? So the muscle is right here, it becomes a tendon and it attaches to the top of the kneecap or the patella, okay? And then it continues on at the bottom of the patella, it comes down and it attaches to the bone below. Okay, so tendons attach muscles to bones. And when that muscle contracts, it pulls on that tendon, and the job of that quadricep muscle is to straighten the knee. Okay, so that tendon allows that to happen. Hello.
Sorry.
No problem. We're just getting started.
Have to write 20 times on the chalkboard.
Okay, so now ligaments. So ligaments are a little bit different than those tendons. A ligament attaches a bone to another bone. Okay, so the ligaments are going to provide more stability to the joint. Unfortunately, ligaments, they have a little bit of give to them, but over time, if you've had injuries to your knees or you spend, if you've done different things, those ligaments, once ligaments stretch out, they can't go back again, kind of like a rubber band. So if you had a rubber band, it's going to have a little bit of a give to it, but over time, if you stretch that rubber band and stretched it and stretched it and stretched it, it's going to lose its elasticity and it's just going to be kind of stretched out. And when that happens, that allows for inappropriate movement of the joints. Okay, so we want to try to make sure that we protect those ligaments as much as we can. Okay, so what's causing your knee pain? There's a lot of different things that can cause knee pain. One of the big things is inflammation. Okay, so with inflammation, you might have swelling in the area. You might have, you might have some swelling in the area. But typically with an inflammation, if you straighten your knee and bend your knee, you can do it without a whole lot of difficulty, okay? Other cause, and an inflammation can cause by, lifting things that are too heavy. It could be that you're wearing bad shoes, so maybe you're gonna go for a walk around the mall at Christmas time, so you're gonna be on your feet a lot of times, but you really didn't wear very appropriate shoes for that, okay? So if you don't have shoes that have support in them, that can cause some inflammation of the knee if the knees aren't functioning properly. Other causes of knee pain could be due to ligament damage or arthritic changes. When there's physical damage to the knee, it's usually pretty hard for you to bend and straighten that knee. You have a lot of pain with that, or maybe it just doesn't straighten all the way. Other causes of knee pain can actually even be like what you're eating. So if you're eating a diet that's high in sugars and carbohydrates and things like that, those promote inflammation, so that can make your knee pain feel worse. Do you need surgery? Sometimes people do need surgery, but a lot of people can get a lot of relief without surgery. And again, do you have the ability to straighten that knee and bend that knee? If your knee is like really super stuck and it doesn't do anything, most of the time what the doctors do, and actually what most insurance companies require, is that you try conservative treatment first. Okay, they don't want to jump right into doing a surgery, but they want to see, does stretching help? Does strengthening help? Basically you want to kind of consider surgery as like the last resort. Unfortunately, I hear from a lot of patients, they'll go to the doctor and they'll complain of knee pain, and the doctor is like, oh, well, it's not bad enough yet, just wait, come back in 10, 15 years, and then we'll do a knee replacement on you. Well, I don't think that that's a real great plan. I think that you should try to do some preventative things to try to see, how can if I stretch appropriately, if I'm strengthening the correct muscles, if I'm doing, the right kind of exercises, see how that feels, and maybe you don't need a surgery at all, or maybe you could get another 10, 15 years out of the knee before you do need to get a replacement. Okay, so exercise. A lot of times when people have knee pain, they're like, oh, my knee hurts too much, I don't want to exercise. And that's actually the opposite of what you really want to do, okay? So, again, stretching exercises. Now, everybody has different reasons that they have knee pain, so, everybody in here may have knee pain, but your reason for knee pain is going to be different than your reason for knee pain, and so it's kind of like an individualized thing. But one thing that is pretty typical with people with knee pain is they have impaired range of motion, and all that means is their knee doesn't bend or straighten as much as it should, okay? And so there's ways that you can stretch those, and stretching is a really important part. Some of the exercises that you can do to help with that would be, number one is, it's called a butterfly stretch. So if you could imagine that I have maybe a stool right here, okay, then I'm going to put my feet up on the stool, it would be putting your feet together and letting those knees drop down to the side. That's called a butterfly stretch. Stretches, you want to make sure that you're doing for a minimum of 30 seconds, okay? If you don't hold it for a full 30 seconds, you're going to improve the flexibility a little bit, but you're not going to actually lengthen the muscles. It takes a full 30 seconds or more for you to be able to do that. Another one, the hamstring muscles, the muscles on the back of the leg, they come down and they attach below the knee, okay? So you want to do a hamstring stretch, and that's making that knee go as straight as you can, okay? And then you'll feel a stretch back behind the leg. Again, you're going to hold that for 30 seconds. Another good exercise to do is to step up onto a step. So if you have steps in the garage this time of year or in the house, you want to step up onto the step and then come back down. Now, if your knees are really bad, you're going to have to use your hand or your arm to help a bit, okay? You might have to pull yourself up. But the goal being that you are using your hand just for some balance and not for pulling you up. We want to strengthen up those muscles in your legs so that you're able to do that. And that's gonna really improve your safety on the stairs as well, or going up and down curbs. Another one that you can do is called a straight leg raise. So with the straight leg raise, there's a lot of different ways that you can do it. You can do it sitting in your chair, and again, you're gonna straighten that leg out, okay? And you're gonna raise the leg up, and you're gonna bring it back down, okay? Now when you're sitting, you're not gonna be able to raise your leg really high, okay? But when you're lying down, if you lie down on your back and you try that same exercise, and again, you would keep the one leg bent, the other leg straight, you're gonna be able to raise that leg up a lot higher. But all those muscles work, because all those muscles cross over that knee, and it's gonna help provide some stability to the knee. Okay. Now, I can't tell you how many patients have come into my practice and said, oh my gosh, I have never been flexible. I've never been able to touch my toes. I hear that time and time again. And unfortunately, stretching gets pushed to the side a little bit, okay? A lot of times people will go and they'll exercise and they'll do things, maybe they go for a walk, but they always skip that stretching part. But the stretching is really important. With the stretching, if you think about your joints, okay, there's usually some type of like a ball and some type of a socket. With the knee, it's a lot shallower than that, okay? But for the most part, there's like a ball and a socket. When the muscles are really tight, it's going to jam that joint, okay? So when you're exercising, you're walking, you're doing things, it's going to put compression through that joint. When you exercise, it takes some of that off, okay? And, what was that? It takes some of that off, and it'll allow that joint to move more appropriately. I turned it off, I think. And so yeah, so a lot of times people don't stretch. Now, if you're not going to or not willing to stretch, the next best thing would to be start out slow. So maybe you're going to go for a walk, okay? So when you first start to walk, you want to walk just a nice, slow, gentle pace, okay? And then after you've been walking for a couple of minutes, then start to pick up the pace. So you want to do some type of like a little warm-up thing before you get going. Same thing, I don't think anybody's a jogger. I'm not a huge fan of jogging. But if you were a jogger, you would want to, walk first, or a runner, if you wanted to walk first and then maybe go to a slow little jog before you actually go full out running. And the only reason that I say about the running is just a lot of compression through all the joints. And it does do a lot of wear and tear. You guys are being super quiet. So you guys, you can pipe up, you can ask questions, So again, there's some things that you can do. I went through some things that you can do at home, but doing a stretch. So when we talk about knees, knees don't work in isolation, okay? They work with our ankles, they work with our hips, they work with our back, they work with our core, and we're going to go into that in a minute. But if you spend the majority of your time in a seated position, those muscles are all going to get fairly tight, okay? So if anybody has known someone who has been in a wheelchair, okay, when that person tries, maybe they can get out of their wheelchair to go to bed or to go to the bathroom, but that's about it, and the rest of the time they spend in their wheelchair. If that person tries to stand up, they're going to be like this, okay? You're not going to see that person stand up like this, okay? Because what happens is when we spend more time in one position, our bodies do what's called adaptive shortening, okay? So with that person in the wheelchair, their knees are bent all the time, their hips are flexed and bent all the time, okay? And maybe they're kind of leaning forward a little bit. So that when they try to stand up, the muscles are too short now. They can't straighten the knee out. They can't straighten the hips out, and they're stuck in this bent position. So, you want to try to stretch those things out. We talked about that hamstring stretch. That would stretch the knees from being, when those knees are tight and they can't straighten out all the way, straightening that knee out and doing that hold, okay, is going to help to improve that so that the person can get their knees a little bit straighter. The stretch that she's showing right now is for the hip flexors, okay? So you could stand against a wall and hold on, okay? But you're stretching this muscle, because again, if you're spending a lot of time sitting, this muscle is going to be really tight. Now, since you guys do get up and you walk around and move around, you're not going to look like this, okay? But maybe you look like this, okay? So you're leaning forward a little bit, your knees are bent, and if that's happening, it's putting a lot more stress through your knees. And we talked about that muscle that came down, those quadricep muscles, and there's that tendon, and then the kneecap sits in there, and then there's another tendon at the bottom. Well, if you're standing with your knees bent all the time, it's pushing your kneecap into your knee joint. And that alone can cause a lot of pain and discomfort and can cause some arthritic changes. Okay, watching your weight. Weight plays a significant role in joint pain. Not just the knees, but the ankles, the hips, the back, and everything. Losing just 10 pounds can decrease the pain in your joints by 20%. So that's pretty huge, okay? So weight definitely, if you think about it, gravity's pulling down on you, and the more weight you have, the more pressure you're going to have on those joints, the more wear and tear you're going to have on the joints. The right shoes. Okay, so there's a couple ladies in here that maybe wear high heels. So what happens is when you're standing with a high heel on, okay, that's going to put more stress through those quadricep muscles. Okay, the lower your heel is, the less stress it is for those muscles. But it's not just wearing lower shoes, it's also supportive shoes. So if you're going to be spending time up on your feet and you're going to be walking or exercising, you really want to make sure that you have a comfortable, well-fitting shoe that gives you good support. A nice arch support. You don't want to buy like a shoe that has like no support in it at all, okay? That it will change how your feet function, and if your feet change, it's going to change how you're standing on that knee, okay? So those are really important. Definitely something that's worth the investment to buy a pair of shoes that does have good support in it. There's a lot of companies now who actually have people who are trained in diagnosing your feet. Like Vernon Powell has a specialist in their store, and I know that the New Balance up in Rehoboth, they have a specialist in there as well, and they will analyze your feet, and they will recommend shoes that are particular to your type of problem, so that it takes less stress on less stress on the knees, less stress on the feet and ankles. Has anybody used any of those services? Have you? You've been happy with those?
Mm-hmm.
Good, yeah.
Yeah, the podiatrist actually sent me to Vernon Powell.
Okay, yeah. So there's and depending on how you're going to use your shoes depends on the kind of shoes that they recommend too. So if you're like going to be doing a lot of power walking or jogging or something like that, they would recommend a different type of sneaker than something else. Okay, core work. So believe it or not, strength around your abdominal muscles are going to affect your knees. Okay, everything in your body kind of works in tandem with other things. That nothing is totally isolated. So they're showing a plank on here. Planks can be challenging depending on your condition, and that's why you'll always see when people talk about exercising, you need to make sure you consult with your physician before you try these exercises, because everybody in here is individualized. Everybody in here can have different conditions, and so there are ways that you can strengthen your core. They're showing a plank. A plank is basically where you're lying on the floor. Your toes would be kind of tucked under, and you're on your elbows, and you're trying to make a nice straight line. That's really a hard exercise for a lot of people, okay? So I'm not recommending, if you have done nothing to strengthen your abdominal muscles, I would not recommend doing this right off the get-go, okay? There's ways you can modify it. But you can also do some simple things like drawing in your abdominal muscles. So when you're sitting in your chair, okay, you can pull your belly button in towards your spine, okay? And you just pull your stomach in and then relax it. Pull it in and relax. You can do that as exercise sets. You can do like 2 sets of 10 of those, okay? You can pull those abs in and then you can hold it. So you could do like a 5-second, 10-second hold and then relax and do it again. The more you can incorporate your stomach muscles into your day-to-day activities, like if you're standing there washing dishes, you could do ab sets, okay? Just pulling your stomach in and relaxing while you're washing your dishes. The more you can do that, the more strengthening you're gonna get, the less back pain you're gonna have, and it will help with the knee pain as well. The other thing is, the core is not just the abdominal muscles, it's actually the buttocks muscles, the low back muscles, and it's the upper leg muscles. So all of those are considered core muscles when you're trying to strengthen everything up. A back extension exercise, just like with the same positioning that you're with that plank, you can lay on your stomach and just raise up onto your elbows and then go back down, raise up, go back down. But again, for some people who have back conditions, that's not a great exercise. You have to kind of know what exercises you can do. But a pretty safe one would be sit in your chair, put a pillow behind your back, and gently press back into the pillow, okay? And then relax, and then press back into the pillow. And when you're doing that, you're trying to do that with your back muscles, not pushing with your heels, okay? You don't want your legs to be doing the exercise, it's your back doing the exercise, okay? All right, you know, there's some other things on here, Tai Chi. There are a lot of good benefits to Tai Chi. Sometimes I'm not, with all exercises, I think that it's best to have a broad approach to it. I don't think sticking with one particular exercise is a good thing, because if you do that, you're going to miss out on benefits of other things. So like the Tai Chi, like yoga, those things are good for stretching, but you're not going to get any kind of cardiovascular with that, and that's an important part of exercising. You want to make sure you're getting that heart rate up, doing some things like the Tai Chi. You're going in in smaller ranges of motion. You're not going through a full range of motion, so you're not going to get that benefit of opening the joints up really big and wide. Massage is good. Again, with that, massage is going to help relax the muscles, but if there is a problem, usually muscles get tight for a reason. Okay, they don't just randomly decide, okay, I'm going to be tight today. It's tight because there's something going on. Massage is good to make it feel better, but you really need to address the problem so that you can get rid of the cause of those muscles getting strong or getting stressed out and tense. So again, you know, trying to fix the ranges of motion, trying to fix the strength. The body a lot of times will tighten up the muscles to try to improve the stability of a joint. And if we can get the muscle strong around the joint, then we don't have those muscles contracting really hard, trying to overwork and cause you issues. Visiting a chiropractor. My husband's a chiropractor. But again, just so happens. But you know, making sure that the joints are in good alignment. If your joints aren't in good alignment and it's causing you to walk weird, okay, so maybe your back's killing you, so now you're kind of walking like this, well, that's going to put a lot of stress on your knees, okay? So that's kind of why we threw that in there. You can try acupuncture. I have never tried it. I know people who have gotten some good results with that. I know people who haven't really noticed much of a change. You know, it just really depends on the person and how they do respond to that. temperature. I hear a lot of times people are never sure, when should I ice it, when should I heat it? They don't know what you should do. There's a little saying that they taught us in school, if in doubt, ice it out, okay? So if you're not sure, throw some ice on it. It's not going to cause you any problems. If you throw heat on there too soon, that can cause problems, okay? So typical rule of thumb is about the first 72 hours, you want to stick with cold, okay? So you can use a gel pack, you can use ice. You want to do that for 15 minutes to 20 minutes max, okay? You don't want to go beyond that. You can actually frostbite the area and cause a lot more problems, especially if you're using real ice. Now the gel packs, they're designed to only hold the cold for a certain period of time, and then they're going to get warm, and it's not going to, have an adverse effect. With the heat, you want to try to do moist heat if you can. So if you have a heating pad, you want to put like a moist towel between you and the heating pad. You want to do like a hot soak, in the bathtub, something like that. But again, it's that 15 to 20 minutes max, and then you want to get out of there again. You can do it 2 to 3 times a day without any problems. Supplements. So some of the main ones that most of you might have heard of is glucosamine and chondroitin sulfate. Anybody heard of those? Yeah. Okay. So the chondroitin will actually, gotta get this one straight because he's my my supplement guy. But with the chondroitin, that helps to prevent the deterioration of the ligaments, and the glucosamine helps to build new, healthier structures. It works in a lot of people, but some people don't see a whole lot of benefits from it. So you have to kind of, try it out and see if it works for you. The other one
with
is
MSM.
What's that?
Without it.
With it.
With it.
You can use turmeric and ginger and a lot of times vitamins and minerals. So a good healthy vitamin and mineral, that will help your body to be able to heal things quicker and better.
If you can find a liquid form of glucosamine and chondroitin, you're better off. If you can't find liquid, then a powder form would be the second choice, and then the least would be a tablet form.
Why?
Because if your digestive tract is not, and quite frankly, as we get older, you don't absorb the way you did when you were younger. And because of that, for instance, with calcium carbonate is only 20% absorbable. So in essence, you're taking calcium in, it's coming right back out the other end. Very little of it's being absorbed. And that's simply because of the size of the element, but also because most calcium is in a pill form or a tablet form. The same thing is true with chondroitin and glucosamine. It's typically in a tablet form. So with a powder form, it's partially broken down already. Your body doesn't have to do as much in order to process it. Typically, a lot of times, people's stomach acids, there's a big controversy actually going on right now. A lot of people take like Tums for acid reflux. And in fact, what's happening, and this is what the latest research is saying, that basically there's too little stomach acid, and therefore the food stays in the area longer, and therefore you start to get a reflux back into the esophagus, and that's where the stomach acid, or the acid indigestion is coming from. So if the stomach acids are right, then you're going to break down the glucosamine and chondroitin better, you're going to break down calcium better, and all foods. It's not going to pass through much faster than it should.
What about lysine?
You know what? Ask me after class, because we're going to get off on a tangent here. We're here for knee pain. I appreciate the question, but...
Okay, So again, switching up your diet, we talked a little bit about this before. You really want to try to stay away from refined carbohydrates and sugars like white bread and sugar and soda and those kind of things. You want to do more whole grains. You want to do lots of fruits and vegetables. If you can get them fresh, that would be great. And then again, you want to have omega-3 fatty acids, so like salmon, oil like olive oil, fish oils, things like that. So healthy kinds of oils, and that's going to help with fighting that inflammation that you might already have going on in your body. I see this a lot. People are embarrassed. They just don't like to use assistive devices. I see a lot of people that I really feel like should be using an assistive device and they just refuse. They won't do it. It's going to make me look old. It's going to do this. It's going to do that. But if you have an injury, using the assistive device, either a cane, crutches, a walker, taking that pressure off of that joint is going to allow that joint to heal faster. Okay, so we really do recommend that, if you need one, don't be worried about it. I mean, there's people out there that are 20 using a cane. Just life happens and things happen to us, and if we need to use something, then we just need to use it. But you want to make sure you're using the most appropriate device for you. So sometimes, people are great with a cane. Sometimes people are great with crutches. Some people can't use crutches at all. I know quite a few people that just can't get the hang of using it. Same thing with a walker. So, if you need more stability, a walker might be the way to go. Maybe a cane is. But you also want to make sure that it's fitted to you and that you're using it appropriately. I don't know if you guys know, but when you're using a cane, you're supposed to use your cane on your good side. Okay, so if I've got a left knee problem, my cane should be on my right side. Okay, so that when I'm walking and I bring my leg forward, I'm putting some of that weight or some of my weight on that arm with the cane, and is taking some of the pressure off of this knee. It's also going to help with stability.
What about the walkers that they keep pushing now that make you stand up?
Yeah.
Are they worth it for people?
It's a great idea in theory, but I don't. Again, if someone has been doing a lot of time sitting, okay, and they're kind of stuck with their hip flexors are tight, so it's forcing them over into this position. Putting my arms up here, I mean, it's not going to make me stand up straight. If I don't fix what's going on here, the only thing that I can do to stand up straighter is to do this, okay? So I'm still stuck here, but now I just put a big arch in my back, and that's going to make my back hurt a lot pretty quickly, okay? So you really need to make sure that you're kind of addressing the reason that that person is hunched over. It's not typically just because this feels more comfortable, because it doesn't. It makes your back hurt. It makes your arms sore because you're putting so much weight on that. So you have to address the ability for the person to stand up as straight as they can first, and then it's going to put them in a straighter position. I haven't worked with anyone using one of those yet. I mean, I've seen them advertised on TV. I just kind of find it, watching the lady in her one walker, and she's doing this, and now she's like up like this, and she's just walking just normal. That I don't see that
Ain't gonna happen.
happening. Not really. I mean, it's going to help some, but
She's gonna end up with shoulder problems too.
yeah. Especially if she is putting her arms up like this and she's stuck like that, that's going to put a lot of stress through the shoulders. The walker, you're not supposed to be leaning and pushing on that walker, okay? You're supposed to be using that just for some stability. So you should just be holding onto it loosely. My arm should be relaxed, and I'm just pushing it and walking normally, okay? It's not meant to be pushed on. Okay, So there's a lot of different resources, and again, this will be on the website, but there's, some of the stuff came, I can't get to the part where it is, but some of the stuff has come from, Johns Hopkins, all kinds of, universities and colleges, where all the information for the pain and what can be done about it. And so I'm gonna kind of wrap it up. I've got business cards up here. It has our website on it. And what we're gonna do is we're going to post the class on the website. But there's also a lot of other information all about different kinds of conditions. So it's a really good resource to just read about different things. There is a link on there. We do have a nutritional store on there, so there are links to that. If you're looking for high quality vitamins, that's available on there. What we're doing as a kind of a thank you for coming out today is we are offering a free consultation. It's not an exam, but just the ability to come into the office for free, just come in, talk about what's going on with your knees, see, you know, what are some options of things that you could do. If you're interested in doing that, just kind of stick around after class and we'll sign it up. I am going to try to get any of those consultations in tomorrow afternoon, because the holidays are coming and people's schedules get really busy during that time, so I am going to have some times, probably from 1 on tomorrow afternoon, you know, if someone wants to come in and kind of talk about what's going on with their knees. So now we're going to kind of open it up to some questions. Yes?
I missed the part, the difference between the ligaments and tendons.
Okay, so let's pretend, we're going to pretend that this is a muscle, okay? So this is my muscle right here. And at the end of my muscle, there's a connective tissue. It's kind of, it looks kind of like a ligament, okay? It's just like this white, so this is muscle, this stuff moves, this doesn't, okay? And this crosses over. So I've got a muscle that comes down. At the end of the muscle, it becomes a tendon, and it crosses the joint. And when I shorten my muscle, and it goes across that joint, it lets the joints move. Okay. Mm-hmm. Now a ligament, kind of the same sort of structure, except it's not attached to a bone or to a muscle at all. It attaches one side of a bone to another side of the bone. So, like for instance, in the knee, there are 4 major ligaments, okay? You've got the MCL, the medial collateral ligament. You've got the LCL, the lateral collateral ligament. And then on the inside, you've got 2 ligaments that crisscross, and those are called the anterior cruciate ligament, the ACL. That one's the one that's most commonly torn. And then you have the PCL. So they don't contract, they provide stability. So if those ligaments are nice and snug and tight, when you're walking, your knee basically bends and straightens. That's it. It can't shift from side to side. It can't shift forward and back.
And what's it connected to?
The bone. It connects one.
Bone to bone.
Yeah, it's bone to bone. So a
Okay.
ligament is bone to bone.
Like a very, very, very thick rubber band.
Yeah. And it has a little bit of give to it. So the knee is actually considered a hinge joint, but it does swivel a little bit as you bend it. There is a little bit of movement, so it is considered a swivel joint. But for the most part, you want that knee to just bend and extend. You also have the meniscus in there. You've got a medial and a lateral meniscus. So at the top of the tibia, again, we said that there's usually one part is round and one's convex, one's concave. Well, the tibia is a little bit flat, but the bone that on the femur is round, okay? And it moves like this, and those meniscus sit right there, and they provide some shock absorption and some cushioning, and it helps to keep that joint more stable because it is rather flat. We don't want it shifting and moving, so the meniscus are like kind of cup shaped a little bit, so that it provides that extra stability in there.
Good.
Yes.
Did you go over what would be inappropriate or wrong to do as far as exercise or,
Well, that's going to depend on the person's condition, and it's going to depend on how much they have exercise. Like, I would not recommend for someone in here who hasn't been doing any kind of exercises, I would not recommend them doing deep squats, okay? Puts a lot of stress through the knees, okay? So, you know, you might want to start out with doing just little teeny baby. And you know, kind of listening to your knees and see what your knees tolerate and what they don't tolerate. But as you continue to do exercises, your knees are going to tolerate more and more. There's, you know, the major muscles that cross the knee are going to be the quadriceps, the hamstrings, and the gastrocnemius. Okay, so that's that big calf muscle. So quadriceps, the job of the quadricep is to straighten the leg. Okay, so you could do, we call them long arc quads, straightening and bending that knee. Okay, let me scoot up here. Okay, so kind of blinding me. So straightening and bending that knee. Okay, that would work those quadriceps because we're straightening that knee. That strengthens up that muscle. You could do for the hamstrings in the back. You could do a hamstring curl. Okay, so you stand and you bend your knee and straighten it. Okay, now there's a lot of ways to kind of cheat when you're doing the exercises. So when I say cheat, what I mean is I wouldn't want to see you doing this. Okay, that is not the same thing as this. We're working different muscles. Okay, so you want to keep that leg back. You don't want to have it coming forward. Because now I'm doing my hip flexors and I'm not really doing my hamstrings at all.
And really the bottom line is to know what's appropriate exercise-wise.
Right.
Actually looking at the muscle lengths, checking which muscles are tight, which muscles need to be stretched.
Right, because you don't want to be stretching. You know, if someone has great hamstring length, I don't want someone to sit there and do hamstring stretches because you don't want to overstretch it and have more flexibility than you're supposed to, because that can cause a whole new set of problems. So you have to know what's tight, what's loose, what's weak, what's strong. So you want a well-rounded muscle. I'll give you an example. A lot of times I'll see people who have decent hamstring length, okay? So a normal hamstring length is if I were to lay flat on the floor and I were to raise my leg up in the air, it should go up to 80 degrees. So almost straight up in the air. That would be normal length for my hamstrings, okay? But I can look at that same person and I can say, okay, let's look at the length of your quadricep muscle. Let's see if those are the right length. And in order to know if, just like that girl's doing right there, if the quadricep muscles are the right length, I should be able to bend my knee and my heel should touch my buttocks, okay? So if you think about your body like a car, if one side, so say my hamstrings are moving along down the road fine, but my quadriceps are all messed up, it's gonna pull, like your car out of alignment, okay? It's gonna pull to the side and it's going to wear things out quicker.
That's where you get degenerative arthritic changes or osteoarthritis.
Right, so I mean, the best thing to do is do an exam and find out, you know, what's going on, what is causing, because your knees don't just decide, okay, I think I'm gonna stop working right. There's something that's causing the problem. And if you can address what's causing the problem, then you can try to eliminate a lot of the pain, if not all the pain. The other thing that you can do is heel raises. So that's to strengthen the muscle back here, okay? So going up onto the heels, coming back down, or off the heels and back down. Okay, so you're on the balls of your feet. Any of the standing exercises, we always recommend that you stand at the kitchen sink so that you've got something nice and stable to hold on to, because you don't want to be losing your balance and falling and getting hurt. So, okay, who else has a question? Yes.
Okay, I'll ask.
Okay.
I mean, you name it, I've been through, which includes chiropractor, acupuncture, plasma injections, second opinion in Hopkins, that type thing. Always one thing comes back in my mind. I wish I could have the family doctor, the surgeon, the physical therapist on a panel to address what you just said, what is really causing it.
Right.
And it seems like we end up getting many times our 15 minutes, here's what it is, and no one truly addresses what's causing it. And if there's a point where that's it,
Right.
you can't do it, and I've not heard
Right.
that.
And
And
that-
here, you don't need a knee operation.
Right.
And oftentimes in physical therapy, in the ones I would not consider the good ones, you go in, you have your evaluation with the head PT, sticks you with a tech, and then the second visit, I could teach a class, you know, they could do this exercise, put the timer on, and come back. There's not a true evaluation for you, it's almost like you're put in this knee group.
Right.
So
Yeah,
you
so
hear a little bit of the frustrations.
Right.
I don't know how
Definitely,
yours works,
Definitely.
but, and
That's,
it's hard to tell whether it's inflation causing it.
Right. Well, we actually, we're a small practice, okay, it's me, I'm the only one, so there is no tech. So every time you're in the office, you work one-on-one with me.
That's a big
And,
plus.
yes, it is. And I think that I kind of, like I said, when I started, I have knee issues myself. And so I kind of feel like I can put a little bit better perspective on it because I know how to modify things because, you know, where if you have some young tech who, you know, they're working with you, they might not have ever had knee pain in their life. They have no idea what it's like to have knee pain. Where I know, like, when I'm doing certain things, like I showed you that deep squat, I don't do those because that stresses my knees. So I know how to make modifications, how to change things around so that it's putting less stress through the knees because I do all these exercises too. And you know, the other component of it, you know, has anyone talked about diet with you? Because that alone can play a huge role in how much pain you're having. If you're eating, you know, lunch meat and hot dogs and soda and energy drinks and refined sugar and white bread and things like that, that is going to cause more pain, no doubt about
a
it.
lot more inflammation.
Yeah, so it causes a lot of inflammation.
Not just the knee though.
Not just
It causes everything.
it will
Well,
cause
it
inflammation
it
everywhere,
affects the
but
weakest
but
area.
right, whatever your weakest link is where you're really gonna feel it.
Yeah.
So yeah, you might not feel it, you might never feel it in those other places, but if you're having a problem somewhere, it's going to attack that area and cause a lot of problems. The other thing is water intake. Are you drinking enough water? If you're not drinking and you're not staying hydrated, those muscles can't stay healthy if you're not giving them, you know, water.
That is something, I'm 78, and I'm reading the ARP magazine, as we age, we lose the ability to know we're thirsty. So you really have to, and I started doing that, you have to
You
force
have to drink, yeah,
yourself.
you have to drink whether
to
you think
drink.
you're thirsty or not. We actually had this conversation with my dad, it's kind of funny, because we were telling my parents all the time, you need to drink more. You need to drink more, you gotta start drinking water, you gotta start drinking water. And my dad went to his family doctor and he said, my daughter keeps on telling me I need to drink more water. Do I need to drink more water? He said, no. Your body will tell you if it's thirsty and don't drink unless your body tells you to drink. And I'm like, what? So about, I'd say not even 6 months later, my mother ends up in the emergency room and gets hospitalized because she is so dehydrated. And the nurses reamed her, they yelled at her, they're like, you older people are all the same, you don't ever want to drink, and she really read her the riot act. From then on, my parents have started drinking all kinds of water and haven't had problems with it, but I've heard people say before that sometimes people will mistake thirst for hunger. So they think they're hungry, but their body is really saying, no, I want water, and we feed it instead of giving us something to drink. But our body is mainly made up of water, and our cells can't function, and the cells control everything in our bodies. And if the cells aren't getting what they need to function, then you're not going to function right. So there's more to just exercise, and a lot of times people can get, you know, with appropriate stretching and strengthening, that's enough and they are good. But that's not everybody. And like you had said, you get to a point where you can't make total correction, you can only make partial corrections. But you wanna kind of look at all the different avenues to see, is it weight, is it diet, is it, lack of fluids, is it lack of exercise, is it inappropriate shoes, there's lots of things that, I think that get overlooked a lot. So, okay, so we've got like 10 minutes, and yes,
I have a question about gait, balance, and knee pain.
okay,
Probably 15 years ago, I had a surgery on my foot that the doctor called a salvage procedure,
okay,
and this foot is not right. It doesn't carry the weight correctly, which means this side carries more weight than it ought to. And so I have hip pain, knee pain, and as I've gotten older, I don't think my balance is as good as it ought to be.
right,
So I think I'm a fall risk, and I think, and it's starting out with hip pain and knee pain.
Do you have flat feet? Do you know?
No, I don't, but the last time I was seen by the podiatrist, this foot doesn't strike the ground correctly.
Okay. And did they fuse things in your foot? Okay. And was it just fused in the foot, or did they fuse the ankle?
No.
Okay. So you might benefit from some stretching exercises of the ankle. So when you walk, what's supposed to happen is you're supposed to do a heel strike first. Okay, so the heel should be the first thing that hits the ground, but you have to have enough range of motion in your foot to do that. And so what happens sometimes, if you watch people walk, you'll see all kinds of things, but sometimes people don't have the strength in their gluteal or buttocks muscles. So what they'll do is they'll swing their leg around when they're walking, okay, because those muscles aren't strong enough, or maybe their hip flexor muscles aren't strong enough. But what's supposed to happen is your heel strikes the ground. At that point, your foot is in what's called a closed pack position, so all the joints kind of get tight next to each other. But then as you come down on your foot, then everything is supposed to relax. Yours can't do that because of what's going on. But, if you have a range of motion with the ankle, so when I shouldn't have worn heels. So when you're standing, check and see if you're able to bring your feet up, okay, without doing this, okay, because that's cheating again. So you should be able to lift the balls of your feet up, okay? If you can't do that, you might drag your foot, come down with a flat foot. If you're going over transition and you're doing that, you can catch your foot on that, and it's a tripping hazard. But anytime you change anatomy, you're going to have compensations. And so you want to try to limit those compensations so you don't have problems. So just like you said, most of the time, people will come in and they're like, oh my gosh, my left hip is killing me, and I'll do an exam, and the range of motion on their left hip is better than their right. And it's because they've been making compensations for so long for that bad side, that the good side is the one that ends up having problems. So yeah, I would check that. And if you want to come in, I can do a real quick range of motion and just kind of look and see what that ankle range of motion is looking like. Sometimes there's what's called active range of motion and passive range of motion. Active range of motion means that you're able to do it yourself, okay? So I'm able to bring that ankle up like that. Passive range of motion, I might be able to move your ankle more than you can move it, and that would be more of a muscle strength problem, okay? So sometimes if I try to move that ankle, it might just kind of be blocked and locked, and there are mobilization techniques. There's what's called a joint capsule that surrounds the joints, and sometimes that gets kind of locked up, and by maneuvering that a little bit, that can loosen things up and let the ankle move more appropriately. But yeah, I mean, if I were to check it and you were able to get it to here and I was able to get it to here, then it's more of a locked kind of problem. But if you can move it to here and then me doing it, I can move it to there, that's a strength issue. So there's, it can be different reasons that things don't function right.
And actually, that goes back to your question a little bit. That's the difference between exam-based physical therapy and protocol-based physical therapy. Protocol-based physical therapy, what's happening is you're seeing a tech, the tech is doing protocols because that's all they've had time to learn, because their education is this long, versus somebody that's actually working with you one-on-one, that's doing more exam-based, and in essence what's happening is as she's treating you, she's assessing with each treatment, rather than doing the same thing over and over and over again for 10 straight visits, and then you get a re-exam. Well, sometimes after 2 visits of doing the same thing, you should progress to something else.
For some people, yeah, some people need to get kind of backed off a little bit. Maybe what's happening is kind of flaring them up a little bit, and you don't want that to happen where you're continuing to do the same exercise and it's flaring up, and you don't, and the doctor doesn't find out about it until the 10th visit.
And
So.
the physical therapist doesn't either, because he's now passed, or she has now passed you on to a tech, which doesn't have the educational background and know the difference. What's right,
And you're
wrong.
also tied into money.
Well, and that's it, because you have
So
a
many
finite
visits.
number of
Right,
visits.
exactly.
And if you're not progressing appropriately, or if they're not progressing you appropriately, then you've used up.
What I typically do in the office is on the first real treatment visit, I start out a little bit slow, okay? And just to see how someone tolerates things, because you can, for some conditions and for some people, you can do things and have absolutely no problems. It's like, oh my gosh, this was like so easy, this was like dumb, I wasted my time with this thing. And then the next day it's like, oh my gosh, I didn't realize, you know, and you can really feel it. So I try to start out rather slow, but then I kind of try out some different things, and actually, in the back, if you don't mind, I've worked with her before, and we don't do the same thing all the time. I try to switch things up a lot, and just to kind of see what is tolerable and what's not, because I'm not going to make you get better if what I'm doing is making you worse. But again, I don't want to be, you know, having you here and you should be over here. You know, we have to kind of check and see, you know, what is your tolerance. I don't want to do a one size fits all, you know, everybody does that same thing. It's got to be what the person is able to tolerate comfortably, so that we can make the best progress that we can.
How do you fit in recommendation-wise with the doctor as far as needing to get an X-ray, next step an MRI, and into that world, or an operation on the knee?
Right. So, you know, a lot of times people come in that have had no imaging at all. Okay. Most of the time, people have had some imaging of their, especially with the knees, because a lot of times people come in after they've had problems with their knees for quite a while. So a lot of times there is some imaging, and basically what we do is we treat for a period of time, and most of the time you'll see progress. Okay, so the person's going to be reporting less pain or less frequency of pain, or, you know, they're able to tolerate more activities before the pain starts at home and things like that. It's when we don't see those changes, of the expected normals, you know, we're not seeing that the person is able to stand any longer, their pain's not changing, or it's changing very minimally, things like that. Then it's okay, I think we need to go back to your doctor and say, okay, we've been trying this for a little while now, we're not seeing the progress that we think we should be seeing. You know, would you, I mean, I can't tell the doctor, okay, you need to order an MRI, but I can suggest, you know, say, you know, he's working hard, things are going, but I'm just not seeing the changes that I think that we should be seeing. You know, do you think an MRI would be appropriate? The insurance companies dictate a lot, and a lot of times they will not schedule an MRI unless they have exhausted most conservative treatments first. Unfortunately, that's what happens. So, you know, getting a lot of feedback from the patient is really important. Yes.
if you have imaging, recent imaging, and you're coming in for a consultation, do you wanna see that imaging, or do you?
Yes, yeah,
Okay.
yeah, report, imaging, all that would be great, you know, just to kinda, you know for sure what's going on in there. Yeah, I mean, it's gotta be, it can't be a just, okay, you're coming in and I'm gonna tell you what to do and I never hear anything back. Like, I need feedback. The more feedback, the better. Because, you know, we're trying to get you the best that you can be,
In some cases, I'll order the imaging
yeah.
if it's not.
You're a chiropractor,
Mm-hmm.
and you are again, what, you told me
A
about
doctor of physical therapy.
physical therapy, okay.
Yep. Okay, so it's 12 o'clock already. So we have to skedaddle out of this room. You know, if anybody